I apologise because I do have a cold, so if I start coughing, just get me some water. Anyway, so about 7 years ago, I applied to university. So I've been now qualified 3 years, but I'll just tell you my story. So I've been a part of REACH all my life, and this is my first electric arm. So I'll just talk you through some of my arms first. So this is me at the Southern, I think. So my main prosthetics clinic was at Westmark in the south of the city. And I had an arm from 3 months old, and every 3 to 6 months for the first few years. And then I moved on to the split hook and cosmetic arms, so that would come off, but that wasn't very safe for my brothers, because they took the raw end of that deal. And then I moved on to the Scamp, my electric hand, at 2 years old, which was quite bulky. But it used to have didn't have the batteries in those days, which I'll show you a picture of. And eventually I moved on to my electric hand. And the one I've got now is my cosmetic hand, and I have 2 different gloves that go over that. And this is a PVC one, which I use for work, and then a silicone arm, which I use for my social life. So here's a cutting from a newspaper. This is my first ever man that brought arms into my life. And so that's that. And that's where you can see where my hand ends, and that's one of my first Scamp hands. And you can see there's a cable that used to plug in, because the battery wasn't a part of the arm at that point, so it was like a mic pack. So it was quite hard. I was quite bad back in the day for using it to dig in the sand and all that kind of thing, so I'd be back and forth with sand in it and breaking it and all sorts. And that was on the front page of the Evening Times. I don't know why, but they chose that image for a girl who probably can't play the piano. And that was a newspaper headline as well, Bionic Babe, which my friends do still call me. And that was our old patron, Jeremy, at one of our old quiz nights. And that was the arm with the battery in it as well. So at school, I've not got great memory of this, but at school I had an occupational therapist that worked with me quite closely, and she would come out to school, and I think my mum had explained to me that in the early years the teachers would just avoid me doing certain things like cutting out, and my mum and dad picked up on it, so the occupational therapist came out and spoke to the school and picked up on that. So then at the start of every year, in the first few years, I would go into the class and explain my arm and show them it, and I did that at Brownies as well. And then through REACH, I got my one-handed recorder, which got me into playing music. And that was fantastic, because I never really thought I was able to do that. And then I moved on to the trumpet as well. And I moved on to do my higher music as well. My lovely Bob. And that's another quiz night as well in Dublin. And I've cut out my head because my bob. Eventually, I was very into dancing, and unfortunately, the electric hand was getting too heavy. And when I was about maybe 15, I gave up on the electric hand, and I quickly lost the muscle in my hand, because you do quickly lose that muscle. It just wastes away. And through REACH, I came upon Murray's Foundation for Limbs with Attitude, and it was I'd still remember it. I got to do climbing walls, I learned how to ride my bike, I did scuba diving and all of that, and it was really, I really appreciated it. I've not done that in years, mind you. So then this is the important part. I got into Glasgow Caledonian University. So when I applied 7 years ago, and I just wrote my personal statement. That's what you had to do. So what I wrote, I detailed my arm and how it's helped me, and how I think it would bring me an understanding and empathy towards children. And I got in. I got an unconditional without an interview. So then this is my last day of uni, this picture actually. So when I did get into university, I didn't have to meet any lecturers to begin with. I got a placement. I got thrown in at the deep end in Children's A&E in Glasgow. And then 3 days into placement, someone notices my arm. And then the uni get a bit freaked out. Everybody gets a bit freaked out. And they were like, what do we do with you? And I said, well, no one noticed to begin with. And then the practice facilitator came out and we worked out what I could do. We worked out what arm was appropriate, so the PVC glove was appropriate for getting gloves over. They just made sure all my hand hygiene was fine. I could put gloves on, all that kind of thing. And towards the end of the placement, I left with a really good report. So what happened was I then went to occupational health, which is something every single student nurse will have to do. So the occupational health nurse I originally saw was not the most positive person. She quickly threw me a syringe pack, and said, open it. And it made me very flustered, and then said, I don't know how you're going to do this, I don't know how you're going to do that, blah, blah, blah. So I left quite upset, and then I was told I had to be referred to a doctor. So then I met this wonderful doctor who I cannot praise enough, who we discussed things with her, and my mum had spoken to a doctor called Tim Smith, who I think is a part of REACH, who's now an anaesthetic doctor. And he gave me a lot of support. And my mum, she's the driving force here, but she researched other nurses. And there was an ICU nurse, there was a stroke nurse down in Birmingham. So there is nurses working. So this occupational health doctor interviewed me and took all this information, and she's now set up a file for any other nurse with similar things to me so that they don't have to go through what I did. And then at university, even though it was rocky to begin with, they were so supportive. I had my professional academic advisor and my disability link lecturer, who I saw at the beginning, but I didn't see throughout my training. So the second placement I had, I was in care of the elderly, and it was a bit of a negative experience because the mentor, who again took a while to broach the subject, didn't think I could do things. She had a preconception in her head that I couldn't do this because she does things her way. So the uni had to come out, and they provided me with the support, and they gave her all the articles, and she was like, oh, you can do things. So she started showing me, she started saying, okay, so let's practice. So we did that, and I ended up running fluid lines and attaching them to the patient, which I then told the university, all excited, and they told me, no, you should only be doing that once you qualify. The only other negative experience I had was in my least clinical placement, which was with a health visitor. And the health visitor had concerns about what I would be doing once I qualify and about picking up babies. Because she got me to come into a family home, a newborn, and lift up the child. And she said, I'll explain to the mother what's wrong with you. And then I will let you... I still can't believe she got away with this. And I'll let you pick up the child. And then afterwards I did it, very nervous. And she told me she didn't feel comfortable because maybe that much, the baby was supported by the one hand. So the university, again, had to come out. And they really fought my corner. And even her representative fought my corner. And she then said, how else would a mother who's got an arm deficiency look after their child? There are them. So how are they doing that? And she said, how will she be able to take blood? How will she be able to do IVs, do injections? I can tell you right now, I can do them all. So that was that. And then because of these negative experiences, the university were really, really supportive. So before and after every placement, I'd meet up with my professional academic advisor and discuss potential things that I might struggle with, might have to adapt to. And the big thing was reasonable adaptation. So Then I moved on, and I have to say, in York Hill, which is the old children's hospital, all my clinical experiences were very positive. Every single mentor I had, they just found my learning opportunities, and all my reports had said I am no different to any other able-bodied student. So that was really nice to hear that. And they just let me get in there, and I was able to pass nasogastric tubes, help with cannulas, assist with moving. I would keep a kind of diary, like on every placement, to say what things I'd done just to prove myself. So that's with that. And on my final placement when I was qualifying, and it's the ward that I work on now, my mentor was really good. She was like, there's things that you might struggle with when you qualify. So she let me make up, without giving them, make up IV drugs aseptically instead in a sterile way, and run IV fluids. So she was really supportive in that way, and it really filled me with confidence about qualifying as well. So I've done all that. And then I graduated in 2013. And my first job that I got, so I applied for 2 jobs in Great Ormond Street. And I applied for haematology oncology and Sky Ward, which is orthopaedic surgical. And so I got the orthopaedic job, and then the haematology oncology job, they said I had the job conditionally if I came back down to London and did a skills lab to make sure I could do IVs. So I picked the job that wasn't making that judgment. So I picked Sky Ward, and that's where I ended up for 2 years. And there's Great Ormond Street. And at that interview, they never spoke about my arm. They never even asked me about it. So what was great about Sky Ward, I looked after patients with orthopaedic conditions, mostly spinal surgery, but lots of general surgical stuff. But I also looked after patients that were occasionally having the toe to hand transfers. And it was great because a lot of them wouldn't realise straight away about my arm. And then I remember speaking to a family, I don't know if they're even here, but who were a part of REACH. And I got to look after them during that. And then there's one patient I had that no one actually picked up. He was having spinal surgery. They had an arm to here. No one picked up on it apart from me. But I have to say, Great Ormond Street was a fantastic opportunity because of the charity. It's got great education. And there I got signed off my IVs about 4 months in. And what my practice educator fed to me was he said, I was a bit worried about you, but he said, your aseptic technique is actually probably better than any other girls here because of the way I hold any kind of cannula or IV, like central line or anything. So that was fantastic. And in this area, I did a lot of moving and handling, a lot of moving patients up the bed, and I was just as capable as anybody else. So a year ago, I moved back to Glasgow for my sons, and I started in Schehallien ward, which is the oncology haematology ward, which is where I was signed off as a staff nurse. And it's a lot of IVs, and it's a lot of injections and stuff like that. So here I'm able to do IVs, injections, subcut and intramuscular, and a lot of passing of nasogastric tubes. And I have to say, one of the few things, people always ask me, what can't you do though? Or they watch me and they say, oh, I love how you do things. But one of the things I do struggle with is getting caps off like the top of a cannula or the top of something. But a lot of the time, I get someone else to do it and they struggle, and then we need to get clamps. So I know it's not me, so I feel better for that. And that's us at Christmas. I was working Christmas Day. This is the downside of nursing. And that's me. Thank you. Any questions?
Rosie Clarke, everyone. Stay here. You're not going away quite yet. Just before we go to coffee, I'm sure there's going to be one or two questions. And while we get microphones out, again, I'm going to ask you the same question I asked James, is when you first thought about being a nurse, and then did you actually have any preconceptions or thoughts about, you know, ability and things? Because one thing you and James are both proving, and everyone we keep hearing about, it's all about ability. And actually, there has normally been some form of case beforehand where somebody's been in exactly the same situation as you. But tell us about those initial thoughts.
Well, I did think about it when I was about 16. And my mum and my gran and my great-gran were all nurses. So I did think about it, and I said to my mum, I'd quite like to do that, but I don't know if I can. And I remember being on holiday with her, and she said, you can. And, you know, my mum is one of those mothers that's the can-do attitude. She is so supportive. Everything in my life has been her driving me behind. And she said, I said, but I won't be able to make a bed because they do hospital corners. So I said to her, I bet you can't do a bed corner with... So she put one arm behind her back, struggling. But she was always supporting me, and it wasn't until about 3 years later that I decided to apply. So. Well
done. As you say, there's always a precedence for this, and it was great that your mum sort of looked all of that up for you. Yeah. We've got any questions? Yeah, down the front here.
Can I just ask a question about, you said about the experiences that you had at school?
Yeah.
How did you overcome that when you went into a different class?
I don't really, I think this is a question for my mum.
Was she watching over you every step of the way?
Yeah. No, she was, when I was doing this presentation, she was telling me all the information, and I couldn't quite remember it myself. But I think it was only the first few years. And I think Mum had said that everyone was quite understanding.
Can you repeat the question?
Mum, would you mind standing up so people can see you first of all?
Can you repeat the question? Yeah. Early on, we realised the best thing for the children, especially if there was a lot of new children around, was for Rosie to be up front and talk about it. And Snowy Owl from Brownies said she'll never forget when Rosie took off her arm and told people...
I was quite confident as a child.
Yeah, she was, rather. Nothing's changed there. But no, I think the best thing is to talk about it. Because otherwise it's kind of myth. You know, there's that child that's got something different, and once they knew about it, then it was fine.
And it makes you stand out.
And I think that's probably a message that we hear over and over and over again, isn't it? Anybody else? Yep. Making you run here, Joe. I think they're doing it deliberately.
Hi there. Sorry, my name's Kirsten. Fantastic speech, talk there. I'm a paediatric nurse in Kent.
Oh, wow.
I've actually got a colleague who's got left above elbow difference. And she was a speaker a couple of years ago, Tammy Barrett, anyone remembers. She's had a bit of a tough time with her training, you know, prejudices, how can you do that, how are you going to resuscitate a child and a baby, you know, hand hygiene. But things she wasn't expecting when she qualified was parents' prejudice.
Yeah.
A father said, "You're frightening my child. I don't want you looking after my child." And sorry to say, but my work didn't support her, and she took it to a complaint as well. So she was taken off looking after that child. Yeah, awful. So it was the parents' problem, not the child.
Yeah.
Have you had experience of that?
Not too much, because in Great Ormond Street, they were very known to Great Ormond Street, and these children have quite complex orthopaedic needs. There was one Arab family whose mum was like, oh, and she was just touching it, but I didn't really pick up on it. No one said anything. Well, there was one, and I think they just feel a bit mortified. So she saw me from the back, and if you see it, it just looks like people don't notice it. But this mum, I'd met her quite a lot, and she said to me, I was standing with my back to her, and she said, "Have those children been beating you up?" Because I think she thought I had a sticky on. And I was like, no, it's just my arm. And then she was like, oh God. And then she went away, and then she went into the room, and one of my closest friends was in there, who's another nurse, and she was telling her, what she said, and she went, oh, she won't care. She just takes it on the chin. And the wee boy started asking her, what is it? And then she was explaining it, and then she was like, how does she put on gloves? And she said, she's just magic. And my friend has got a skin condition, so she wears green gloves. So she was wearing her green gloves, and she's like, is it like your green gloves? And she was like, yep, that's like that. And ever since, he's like, it's magic. And I have to say, I get called by one of my patients who I'd looked after for 2 months, who they touched my arm one day, and then it's when they noticed the difference of what it feels like, and she calls me Barbie arm. And but she shortened it to Barbie, which I quite like. I'm like, that's fine, I'll take that. And a doctor, well, actually, one of my pals who I worked with, an Irish nurse down in London, he calls me Nemo, because Nemo's got a small fin. And then I was in, no, but it's funny. I was in, so he was in London Zoo and takes a Snapchat of Nemo and sends it to me saying, found you in the zoo. And I opened it hoping it wasn't a hippo. And then and then I told one of the doctors here that I get on really well with. So he started calling me Nemo as well. And then someone went, why are you calling her that? And they were like, you can't call her that. I think I let people do that kind of thing too much though.
Well, I think it's time for coffee, but we'll have plenty of time. So Barbie, Nemo, Rosie, whatever you like to be called, thank you very much. Ladies and gentlemen, Rosie.